So question here, the patient statement or patient say that state, my stomach hurt about the 2 hours after I eat. So after I eat, it is the keyword. Based upon this information, the nurse suspect the patient likely is a gastric ulcer, duodenal ulcer, peptic ulcer, or crawling ulcer. So gastric ulcer and duodenal ulcer are the type of peptic ulcer. The main difference or the main distinction is that they affect different part of digestive system, right? So the correct answer here, answer B, means duodenal ulcer. Duodenal ulcer is always occur after eat. So in case of the gastric ulcer, it is reduce the defense factor in the stomach, and also most common in the age of the patient 45 to 55 years, but duodenal ulcer most common 35 to 45 years, and gastric ulcer always after the food intake, epigastric pain increase, but duodenal ulcer after food intake, epigastric pain decrease, right? The person who have gastric ulcer, loss of weight, and the person who have duodenal ulcer, they gain weight. So the answer here, I said, individual with ulcer within the duodenum typically complain of pain occur 2 to 3 hours after food or after meal, as well as the pain at the night. So the pain is usually relieved by eating. So the pain associated with gastric ulcer, answer A, occur 30 minutes after the eating. And answer C is too vague because gastric and duodenal ulcer both together we call peptic ulcer, and does not distinguish the type of ulcer. And answer D, associated with a trace. If anybody have a ulcer or anybody develop the ulcer because of trace, we call curling ulcer. Like a patient have a history of burn and patient develop the ulcer. Next question. The nurse is caring for a patient with suspected diverticulitis. The nurse would be most prudent. Is questioning which of the following diagnostic tests: abdominal ultrasound, barium enema, complete blood count, and computed tomography, right? CAT scan. So the correct answer is B, means barium enema. Why? Barium enema is contraindicated in the client with the diverticulitis because it can cause the bowel perforations. You see, the nurse would be most prudent the questioning which following diagnostic test. So I said barium enema contraindicated in the client who have diverticulitis, because barium enema can cause perforation of the bowel who have diverticulitis. Answer A, C, and D. Appropriate diagnostic studies for the client with suspected diverticulitis. What next? The nurse is planning care for a patient with celiac disease. In teaching about the diet, the nurse should instruct the patient to avoid which of the following for the breakfast. Avoid. So one is puffed wheat, banana, puffed rice, or cornflakes. So the correct answer to avoid, right? Definitely a wheat product. So the client with celiac disease should educated, advised not to eat or from the eating food containing the gluten. Gluten containing food must be avoided who have celiac disease. Food with gluten, including wheat, barley, oat, or rye. The other food are allowed who have celiac disease. Next, the nurse is teaching about the irritable bowel syndrome, shortly called IBS. Which of the following would be the most important? Number A, reinforcing the need for a balanced diet, encouraging the client to drink 60 ounces of fluid with each meal, telling the client to eat a diet low in fiber, and number D, instruct the client to limit his intake of fruits and vegetables. So my patient diagnosed irritable bowel disease. Which following would be most important? The correct answer said reinforcing the need for a balanced diet. So the nurse should reinforce or educate the need for a diet balanced in all nutrient and fiber. Foods that often causes diarrhea and bloating associated with irritable bowel syndrome include the fried foods or caffeinated beverages, alcohol, spicy food. Therefore, answer B, C, D are incorrect. And question, in planning care for the patients with ulcerative colitis, the nurse identifies which nursing diagnosis is a priority. Number one, anxiety. Number B, impaired skin integrity. Number C, fluid volume deficit. And number D, nutrition's altered less than body requirements. So ulcerative colitis, identify which nursing diagnosis is a priority. Correct answer is fluid volume deficit, right? Fluid volume deficit can lead to metabolic acidosis and electrolyte loss. The other nursing diagnosis in answer A, B, and D might be applicable, but are of lesser or less priority. Most priority is the fluid volume deficit. Next, here, the patient is prescribed Metronidazole. Also, it is called Fragile, for the treatment of duodenal ulcer. When teaching about this medication, the nurse should include what? This medication should be taken only until you begin to feel better. This medication should be taken on an empty stomach to increase the absorption. Number C, while taking this medication, you do not have to be concerned about being in the sun. Number D, while taking this medication, alcoholic beverages and products contain alcohol should be avoided. So correct answer, metronidazole for the duodenal ulcer. Teaching which medication nurse should include. The correct answer is number D, right? So while taking this medication, alcoholic beverages and products containing alcohol should be avoided. So alcohol will cause extreme nausea if consumed with the metronidazole. So alcohol and metronidazole not together. Answer A is incorrect because the full courses of treatment should be taken. The medication should be taken with a full 8 ounces of water. And the client should avoid direct sunlight because he will most likely be photosensitive. Therefore, answer A, B, and C are incorrect. And next here, the nurse is preparing to administer a feeding via nasogastric tube. The nurse would perform which of the following before initiating the feeding? And number A, assess for tube placement by aspirating stomach content, and place the patient in left lying positions. And number C, admin feeding with 50% dextrose, and ensure that the feeding solution has been warmed in a microwave for 2 minutes. The correct answer is C, feeding by nasogastric tube. So nurse would perform which following before initiate the feeding? Number 1 is a correct answer. So assess the tube placement by aspirating stomach content. Why? Before beginning the feeding, an X-ray is often obtained to check for the placement of nasogastric tube. Or aspirating stomach content and checking the pH for acidity is the best method of checking for the placement. So if the content is acidic, means the nasogastric tube up to the stomach. What is our destination? Other method including placing the end in water or checking for the bubbling and injecting the air and listening over the epigastric area. Also important, and as a healthcare provider, it is good to know. Answer B, answer C are not correct, and answer D is incorrect because warming in the microwave is a contraindication. And next question here, which is true regarding admin antacid? Number A, antacid should be administered without regard of mealtime. Antacid should be administered with each meal and snack of the day. Antacid should not be administered with other medications. Number D, antacid should be administered with all other medication for maximal absorption. So what is the correct answer? The correct answer said number C, antacid should not be administered with other medication. Why? Antacid should be administered with other medications. Should not be administered, they said, which is true, right? They said should not be, right? So let me tell you, antacid should be administered with other medication. If antacid are taken with many medication, they render the other medication inactive. So all other answer is incorrect except C, because antacid should not be administered with other medications, right? So number 9 here, the nurse is caring for a patient with colostomy care. The patient asks, will I ever be able to swim again? Colostomy. The nurse's best response. They said, yes, you should be able to swim again, even with the colostomy. Number B, you should avoid colostomy. Is colostomy in water? No. Number C, no, you should avoid getting colostomy wet. And number D, don't worry about that. You will be able to live just like you did before. So the correct answer is number A, right? So yes, you should be able to swim again, even with the colostomy. So the client with colostomy can swim and carry on activity as before the colostomy. And also answer B, C are incorrect. And answer D show a lack of empathy, that you will be able to lie just like did before. Definitely it is not true. And next question. The nurse is assisting in the care of a patient who is 2 days post-operative from a hemorrhoidectomy. The nurse would be correct in structuring the patient to number A, avoid high fiber diet. Number B, continue to use ice pack. Number C, take a laxatives daily to prevent constipation. Number D, use a sit bath after each bowel movement. So correct answer is number D, use a sit bath after each bowel movement, because patient has a hemorrhoidectomy. So as I want to tell you, the use of sit bath will help with the pain and swelling associated with hemorrhoidectomy. The client should eat food high in fiber. So answer A is incorrect. Avoid. No, they should eat high fiber. So ice pack is started in answer B, are ordered immediately after surgery only. After surgery, not every hemorrhoidectomy. And answer C, incorrect, because taking laxative daily can result in diarrhea. And next, yeah, the nurse is assisting in the care of a client with diabetic like colitis, right? Which of the following assessment findings must necessitate in immediate report to the doctor? So what is our answer? Number A, bowel sound are present. Number B, intermittent left bowel lower quadrant pain. Number C, constipations alternating with diarrhea. Number D, hemoglobin 26% and hematocrit 32. So correct answer is number D, hemoglobin 26% and hematocrit 32. So the low hemoglobin and hematocrit might indicate intestinal bleeding. So answer A, answer B, answer C are incorrect because they do not require immediate action, right? And next go, the client is newly diagnosed with juvenile onset of diabetes. So which of the following nursing diagnosis is a priority? Anxiety, pain, knowledge deficit, and altered thought process. So correct answer is number C, knowledge deficit. Priorities, they say. So the new diabetics has a knowledge deficit is a priorities. Answer A, anxiety. Answer B, pain. And D, altered thought process are not supported within the stream and are incorrect. Next, the nurse is asking by the nurse aide, are peptic ulcer really caused by the stress? The nurse should be correct in replying with the followings. Number A, peptic ulcer result from overeating fatty foods. Peptic ulcer are always causes from exposure to continual stress. Number C, peptic ulcer are like all other ulcer, which all result from stress. Number D, peptic ulcer is associated with H. pylori, although there are other ulcer that are associated with ulcer. So the correct answer is number D, right? That peptic ulcer associated with Helicobacter pylori. This is the underlying organism that causes peptic ulcer. Although there are other ulcer that are associated with the stress. So let me tell you, peptic ulcer are not always related to the stress, but are a component of the disease. Answer A, B are incorrect because peptic ulcer are not caused by overeating or continued exposure to the stress? Answer C is incorrect because peptic ulcers are related to but not directly caused by the stress. And next question said, the nurses assisting in the assessment of the patient admitted with extreme abdominal pain. The nurse asks the client about the medication that he has taking, because why asking about the medication? Is there any relation medication can cause abdominal pain? We have to evaluate. So asking questions. Number A, interaction between medication will cause abdominal pain. Number B, various medications taken by mouth can affect. Number B, various medication taken by mouth can affect alimentary tract. Number C, this will provide an opportunities to reduce the patient regarding the medication used. And number D, the type of medication might be attributable to an abdominal pathology not already identified. So the correct answer, number B, right? Various medication taken by mouth can affect the alimentary tract. This is the answer. Why? So many medication can irritate the stomach and contribute abdominal pain. So we will ask what medication take, like pain medication, non-steroidal anti-inflammatory, ibuprofen. If you take empty stomach, it can cause the pain, right? So for example, number A, not all medication between medications will cause abdominal pain, not all. Although this might provide an opportunities for the teaching, and this is not the best time to teach. Therefore, answer C is incorrect, and answer D is incorrect because medication may not be cause the pain, right? So answer B is a correct answer.